Good morning, everyone. It's 11 a.m., so we'll go ahead and get started. Welcome. I'm Christy Campbell. I'm the director here at the Cole County Health Department. The first thing I wanted to do this morning was really emphasize the expectations that we have for everyone in Cole County to follow the guidance and recommendations, expectations that we have put out in the advisory, and we've put out several times since the beginning of this pandemic. You know, we expect everyone to stay home if you're sick, monitor your symptoms, and seek medical attention if needed. If you've been tested for COVID-19, we do expect you to stay home in isolation until you receive those results. We expect others to physical distance from the others outside of your household. That means limiting gatherings and avoiding those situations where you can't physical distance, where you can't maintain that 6 feet of distance with someone for more than 15 minutes. And if you have to be in those situations where you can't maintain that physical distance, to wear a mask that covers your nose and mouth. We encourage everyone to telecommute and physical distance within office buildings, use those offices, don't congregate in those communal settings. And if you have to, again, be within that close contact with someone, to please wear a mask. We've been encouraging restaurants and other businesses to offer low contact shopping methods, curbside and delivery, to increase the distance between the seating in restaurants and other offices, and to do everyone to do what they can to slow the spread. We realize the virus is here and we have to deal with it, and we need to all take precautions to slow the spread. We also want to encourage everyone to focus on building up their immune system, especially in the fall. We want to encourage those healthy habits like eating a balanced diet, exercising, taking your vitamins, drinking water, getting your flu shot, and also seeking out those other preventative screenings, because building that healthy immune system and being healthy is going to help us fight all the viruses or any illnesses that we might come in contact with this fall. I'm going to turn it over to Chesney Schulte now. If she was able to get on, she was having a little technical difficulties because she was going to talk about that new guidance that we just received from CDC late yesterday. Chesney's on, but her label says Jennifer. So take it away, Chesney.
Hello, this is Chesney with the Cole County Health Department, and I just wanted to update you on that new guidance. So Centers for Disease Control and Prevention recently updated the quarantine period for an individual exposed to COVID-19, and now recommends 2 additional options for how long quarantine should last. For people without symptoms, quarantine can end on day 10 without testing, or on day 7 after receiving a negative test result. For stopping quarantine, people should watch for symptoms until 14 days after exposure and practice preventative measures. Wash their hands often, avoid close contact, cover their mouth and nose with a mask, clean and disinfect commonly used surfaces. If symptoms develop, they should immediately self-isolate and contact their healthcare provider. One factor to consider with this new guidance is the burden of additional testing of asymptomatic close contacts. The local availability of testing supplies and the capacity to produce a quick turnaround time for the test results may prevent testing negative and ending quarantine 7 days after exposure. As always, this is an evolving situation, and we will find that many local public health departments, school administrators, and employers are developing new protocols in the time since CDC updated the quarantine period. We appreciate your patience and understanding. Thank you.
Thank you, Chesney. Now we will go to Dr. Robbins with JCMG. Good morning, Dr. Robbins. I think you're on mute.
I am. Sorry about that. Thank you, Christy, and thanks for everybody giving me the opportunity to speak. This morning, I presented the concept of a mask mandate for both the county and the city to the Jefferson City Medical Group Board, and it was a resolution supporting that was overwhelmingly voted to move forward with. And what I'll just go ahead and do at this point, I think it'll make the most sense, is I'll go ahead and just read the resolution. It might seem a little dry, but I think it's well written, and we've already sent emails to all the members of our task force that the mayor has had us on for the last several weeks. So I'll start with this. There is sufficient clear scientific evidence that wearing masks is one of the most effective available tools to slow the spread of COVID-19. Wearing a mask decreases transmission of the coronavirus and is a readily scalable measure to ensure everyone's health during this pandemic. A growing body of scientific evidence suggests that mask use can be the difference between life and death for some Americans. To show respect and compassion for patients, providers, nurses, and other frontline healthcare workers in our communities, Jefferson City Medical Group unequivocally endorses, the public to wear face masks and urges the County of Cole and the City of Jefferson to issue a mask mandate. While concerns that a mask mandate might oppose personal freedoms, individuals who choose not to wear a mask endanger the personal freedoms of others by potentially jeopardizing their life. A good analogy would be a seatbelt law. The seatbelt laws were not instituted to limit freedom, but to potentially save lives, which they clearly have done over the many years that they have been in place. While the seatbelt law is permanent, a mask mandate is temporary and intended to be for the protection of the community at large. A mask mandate is the surest way to ensure that our schools, businesses, and healthcare facilities are able to stay open and that medical practices are able to continue to offer a full array of care for the residents of Cole County and surrounding communities. The Centers for Disease Control and Prevention, the CDC, has affirmed that wearing masks can help communities slow the spread of COVID-19 when worn consistently and correctly in public settings. Masks work to decrease the risk of infection for everyone. And there really is a fairly overwhelming body of evidence, as I mentioned earlier in the resolution, in our scientific literature that does show a substantial decrease in the prevalence of COVID infections and therefore in ensuing deaths. So I would really encourage both the county and the city to take up this resolution and this recommendation based on scientific evidence. This is not based on, hearsay. This is based on some firm evidence, and we would just encourage that we move forward with this for the sake of our community. Thanks very much.
Dr. Hay, would you like to give us an update from Capital Region Medical Center?
So Capital Region continues to have a large number of patients in the hospital. Today we had 29 patients, which is fortunately lower than our peak about 7 to 10 days ago. However, we continue to prepare for post-Thanksgiving and post-Christmas time in which people may have gotten together. And so we're making preparations for that. One of the things that I get asked about is what does it mean to quarantine? So again, earlier they talked about quarantining and the time of quarantining and the changes. But what does it mean when you're asked to quarantine due to exposure or if you have COVID? So the first thing to remember with quarantine is that you stay away from others. And the easiest way to do that is to stay at home. There are times when you need to seek medical attention, and we strongly encourage everyone to seek medical attention when they need to. And that can be either through a telephone visit, a virtual visit, and sometimes for physicians and providers to see patients in person in their office or even in the emergency room. However, when making those in-person visits, it's important to make sure that a patient is properly wearing their mask and also has properly identified themselves in every situation that they have COVID or been exposed to COVID, so that everyone can make sure that they are following all of the protocols as well. One of the concerns many of my patients have had is, what do I do to get food? What do I do to get supplies? Most of my patients are able to contact neighbors, friends, family, and have set up a table out front. So if they need some supplies, a neighbor, friend, or family will go to the grocery store for them and get their groceries for them and place it on a table so that they can still be separated from one another out front of their house. And so there's many different creative ways in which we're able to get supplies that are needed at home. When you are in a home situation with your spouse or family or friend or significant other, it's important to continue to try to quarantine from one another as much as you can, from a person who's been tested positive for COVID and one who is just a contact at this point. Try to maintain distances. If you have to be close to one another, make sure that both of you are wearing masks, both of you have washed your hands properly, and if you minimize the close contact and then separate further than the 6 feet that's considered a close contact as much as you possibly can. This is to try to help not only the person who is positive for COVID, but also the contacts that they're having in their home. And certainly none of us would want to give COVID to our family members. So those are just some suggestions and hopefully helpful hints on how you can handle quarantine. Certainly if you have questions, contact your physician or provider in case that you're stuck and don't know what to do. We're all here in the community to help one another to make sure that we all get through COVID as best we can. Thank you.
Thank you, Dr. Haight. Now I'd like to call on Dr. Sullivan from the Community Health Center of Central Missouri.
Thank you. I think we're all tired of COVID-19, but I think it's important for us to remember it is still here. We all need to do what we can to protect ourselves, each other, and our community. As a physician who lives and works in our community, please help us so that we can be there to help you. And I think Dr. Haight and Dr. Robbins have given some great advice on ways that you can help us so that we can be there to help you. That's all I have. Thanks.
Thank you. Dr. Adams from St. Mary's.
Morning, thank you. I agree with the other physicians on the call who've all mentioned that with the holidays upcoming, we do have a great concern that there could be another surge in our community. I think things right now have kind of leveled off a little bit, although we do have very high number of ventilated patients in the ICU. So now is not the time to forget all of our good hygiene when it comes to preventing the coronavirus. We do, I'm sure you've heard in the news, and I am optimistic, we have a milestone that we're approaching in the pandemic, and that is that soon we'll have a vaccine that we expect will be approved for emergency use authorization. The FDA has hearings for the Pfizer vaccine on the 10th of this month, and then the Moderna vaccine on the 17th of this month. And we do expect that they'll be approved for emergency use authorization. We could get shipments of the vaccine as early as December 15th in the state of Missouri. And we are spending a lot of time preparing to vaccinate our frontline healthcare workers. We don't know if we'll have enough vaccine to vaccinate all of them, but we do expect that they'll continue to manufacture and ship more vaccines as they become available to the Missouri area. We're also optimistic because the efficacy of the vaccine is reported to be above 90% as long as you get both doses in the 2 series vaccine. So Pfizer has, it's a 2 series, so 2 shots, 21 days apart, and Moderna's vaccine is 28 days apart, two shots. Now, unfortunately, right now, it's not going to be available to the general public. That's a common question that we get. but we are planning for mass vaccination of the general public, and this plan is currently underway. And we're hoping that by the spring, there might be enough of the vaccine delivered to the Missouri area that we can perhaps start vaccinating other essential workers, people with a lot of comorbid conditions who would have poor outcomes if they contracted the virus, and then, continue to offer the vaccine, going down the tiers of priority, making sure that we go with the frontline healthcare workers first, getting all of them vaccinated so that they can all be available to take care of us when we get sick, and then moving on to essential workers and people with a lot of comorbid disease. Thanks.
Thank you, Dr. Adams. Mayor Carrie Turgeon, would you like to say anything today?
Yes, thank you. Commissioner Sam Bushman was not able to be on this call, so I do want to speak for the city and county unified in reminding everyone of the city and county COVID-19 advisory dated November 12th, and this is still current and has some very pertinent information, and I'm going to point out the highlights. That Cole County and City of Jefferson are advising every person in Cole County that if you're sick, stay home. Physical distance from others outside of your household, limit gatherings to a number that physical distancing can occur, and avoid gatherings where physical distancing cannot be maintained. Wear a mask if you cannot physical distance, and avoid gatherings. Encourage telecommuting and physical distancing within office buildings. Offer low contact shopping methods, including curbside and delivery, and increase distance between seating in restaurants. So I'm here to remind everyone, as we think of this season of giving, don't get it and don't give it. Something that we can all do. This is not about who's weak and who's strong. This is not about that. We know that there are people that have issues or may not have issues, and we really don't know until it happens, but we've got to come together and help one another and care about our neighbors and our family and our friends and our coworkers, and take these precautionary steps. We need to care for our healthcare providers that are keeping our hospitals open for us, and the doctors that are nurses, and everyone that's working so hard to maintain our hospital systems for us. So reminding everyone that we have these precautions in place, and this is not the time to get sidetracked on whether it's mandatory, not mandatory, if they're going to be punished or not punished. This is very clear advice that we need to follow. And those are things, whether it's a mandate or not, that, as we know, are being discussed as we speak. But regardless, this information is out and it's very clear what we need everyone to do. This is a serious call to action. I need everyone to share this with their family and friends. This recording here will be available. It'll be uploaded and available on the city website. If not today, then by tomorrow morning. We need people to share this. We need people to share this advisory and the bullet points in it. So like I've said before, I've sounded the alarm. I've sounded the warning. And if you haven't heard it, then you're not listening. So we really need everyone to listen. Listen to our doctors. Listen to everyone that was on this call today and talking about how important in taking all precautions. It's important that we do every single one of them. It is not a one size fits all. There is not one thing that will take care of all of this. We need to do every single thing that we've all been talking about, everyone, and we can do it. I have confidence that our city can do this together, and we have to do it. So take all of these precautions, don't get it and don't give it. Let's do our part and listen, and appreciate everyone working together. This is not the time to get divisive and divided about it. This is the time that we all have to work together, every single one of us in our community. Take all of these precautions, listen to our doctors, listen to our health department. We need you, share this information, do your part, stay 6 feet apart. Thank you.
Thank you, everyone, for sharing all the information today. There's a lot of great points that were covered, a lot of great education. I'll open it up now to see if anyone else has a comment or if anyone has any questions for the panelists. Okay, well, hearing no questions, thank you again. And please, adhere to the guidance and share the guidance in the advisory and do our part and have a safe week. Thank you. Bye-bye.